Kelly for Texas Pediatric Dentistry, and today I'm going to talk a little bit about fluoride. Now, fluoride is a naturally occurring mineral that is very important for your child's oral health. So I want to teach you a little bit about it and why it's important, and tell you a little bit about the kind of fluoride that they get when they come to our office. The reason fluoride is important is because every day our teeth are going through a process called demineralization. And basically that's where your enamel is being broken down from the acids in your mouth, bacteria and sugars. And those things are constantly breaking down our enamel. And so we have to remineralize our teeth in order to keep them healthy. And one of the ways that we remineralize teeth is through fluoride. Now, you do get fluoride. Most people get fluoride in their drinking water, and then of course there's fluoride in certain toothpaste and other products at home. But it's also very important to get a stronger fluoride treatment every time your kiddo comes to the dentist for a cleaning or checkup appointment. Really typically fluoride treatments at the dentist start around the age of 3. And this is the same, around the same age that you should start using fluoride toothpaste at home. Prior to that age, fluoride is, it's a very safe product. However, when kids are super young, if they were to swallow too much fluoride, either at the dentist or at home, if they ate toothpaste or something like that, that can be toxic for them. And it can also cause some discoloration of their teeth called fluorosis. So we definitely want to avoid that. So prior to age 3, we do recommend that your children don't use fluoride toothpaste at home. They need to be using something called toddler toothpaste or training toothpaste, which typically kind of looks and tastes like toothpaste to get them used to it, but it doesn't have fluoride in it. Now, once they're around the age of 3, most kids are good enough at being able to spit excess toothpaste out of their mouths to where they should be able to start using fluoride toothpaste just a teeny tiny bit, like the size of a pea or smaller. They should be able to start using that at home with your supervision and your assistance. Make sure that they spit and they rinse it out of their mouths and everything. And then, at the same age, typically we start doing fluoride treatments here in the office when they come in for their cleaning appointments. We do have 2 different types of fluoride that we use here at the office. The first type is called varnish, and it's what we use on little kids when they are first starting to get the fluoride treatments. And then sometimes we use it on older kids as well, just depending on certain circumstances. But what varnish is a very sticky form of fluoride that we paint on their teeth with a little with a little paintbrush. And it's very sticky and it adheres to the teeth really well, and it prevents them from swallowing any extra. And kids tolerate it really well. When we paint this on, it has to stay on your child's teeth for 12 hours without brushing it off. So a lot of times the kiddos will need to skip the brushing that evening after they've come into the office, depending on what time they're here, and that's fine. It needs to soak in for 12 hours. The other type of fluoride that we use for older kids is a gel fluoride, and that's something that we brush on their teeth with a toothbrush, and that fluoride needs to stay on their teeth for 30 minutes without eating or drinking or rinsing at all. And that does count water. They can't have water or anything for 30 minutes afterwards. And this is used with older kids. It has to be spit out a little bit. They spit it into our suction straw, and older kids do that really well. So that is what we use. Fluoride is very important, and we do recommend it at all of the cleaning appointments that your kiddos come in for twice a year. And if you do have any questions or concerns about fluoride in our office, or what you're using at home, or the fluoride in your water, please let us know. We are happy to answer your questions, and we'd love for you to learn more about us at TexasPediatricDentistry.com. Thank you so much.